we had approximately 47% or 488 of the 1,036 doctors reporting for work, 22% or 86 of the 387 expected in the Southeast Health Region, reporting 51% Northeast, 57% or 165 in Southern Health Region, and while 73% or 179 of the expected 245 turned up in the Western Health Region. We've monitored the situation. We've tried to ensure that services continued. The consultants came out and other support staff to ensure that the critical services were maintained. It's a regrettable situation for so many doctors to be not well on a particular day, and clearly there are issues that have to be resolved to make them well. And I've had a couple of meetings today. We started off late this evening because I was in a meeting, and I left that meeting to come here. The PS is still in that meeting. I think we're making progress, but I'll say no more than that until the meeting ends, which hopefully will be soon, at which point I've asked that a statement be sent out to indicate where we are in terms of the discussions. I close that segment for now by saying that all our medical clinicians or medical practitioners are important. Public health is at a critical juncture. The country has depended on us and has given us support over the past 15 months to deal with this pandemic. There have been a lot of sacrifices made, and our medical team have been on the front line at all levels: nurses, doctors, community health aides, the epidemiologists, the planning people, and they've all made sacrifices. So the issues that we face and the decisions that are taken are in no way meant to devalue the importance of our clinicians and the public health team. They are all very important, and we always strive to resolve those issues and resolve them in an amicable way. And this is what we will work to do.